Okay, here I am with Rosemary. And Rosemary, you came to our office several months ago, and tell us about some of the health challenges that you were having before you started seeing us.
Well, before I started seeing you, Dr. Taggart, I had fibromyalgia, and I was tired all the time. I worked full-time as a nurse, and I would come home from work really exhausted. I would eat dinner and go to bed and struggle to get up the next morning. It was very hard to get up. I would set like 3 alarms.
3 alarm clocks, yeah, I remember that. 3 alarm clocks.
Yes.
Just to get out of bed, because you're afraid if you don't set up 3 alarm clocks that you wouldn't be able to get out of, you wouldn't get out of bed.
That's
You'd
right.
oversleep and not go to work on time.
Right.
Okay, very good.
And I was having a lot of muscle pain and generalized fatigue, and kind of difficult to get through the day with concentration.
Staying alert throughout the day.
Right, energy dipping at 3 o'clock. And
all right. And because of that low energy and the pain, were you concerned about being able to stay in your full-time job?
Yeah, I was thinking I may have to cut my hours.
Okay, all right. And so we had issues with chronic pain. We also had issues with fatigue. We also had some challenges with our immune system. Tell me about that. Allergies and the asthma. Oh
yes, allergies to like everything, foods and seasonal allergies. If it's green and it grows, lots of allergies, and kind of like brain fog sometimes too, difficulty concentrating.
Okay, good. And how has your immune system improved since when you started your care?
Greatly, and I attribute that to the
change in the diet.
Big change in the diet, and also the nutritional supplements that I'm sure you gave me.
Right.
And I think the chiropractic care. I think the holistic approach that you use.
The neurological brain-based therapy, the chiropractic care, and the change in the diet, and also the nutritional supplements to kind of balance you both neurologically and metabolically. And with what we've done, you've been able to reduce your medication usage pretty significantly. Is that correct?
Oh, a lot. I stopped taking antihistamines and Singulair. Yeah.
Okay, awesome. Very good. And as a result of being on our program, you're overall feeling a lot better. What has that done to the anxiety level that you were kind of suffering with prior to seeing our office? How has that changed?
It's decreased it a lot. And with my home exercises, I think that's improved it a lot too.
So you got energy when you get home and energy on the weekends so you can do things. And tell us about how happy your husband is that you're doing so much better.
Well, my husband is really happy because sometimes I even spend time with him, but I also go out with my friends too. So sometimes I do leave him at home, but he's really happy because I have a social life now besides a work life.
That's wonderful. So with all these different improvements that you've had, would you recommend our office to anyone who is having any chronic health condition?
Absolutely.
Very good. Thanks so much, Rosemary.
Okay.